For healthcare to improve, we need to understand ourselves better, understand the human in the room, accept our limitations. We need to design our environments, the systems we work in, to get the best out of us. We need to acknowledge our herd mentality and design not only our physical environments, but also our governance structures to accommodate for this. We need to transition from our dominance hierarchies and adopt alongside them teams of networked teams, encouraging diverse thinking and ideas to be shared. Given the right conditions, we'll thrive, and we'll thrive in the right way. Because as my 7-year-old daughter points out, we're actually pretty smart.
According to research at Cambridge University, it doesn't matter what order the letters in a word are. The only important thing is that the first and last letter be at the right place. The rest can be a total mess, and you can still read it without a problem. This is because the human mind does not read every letter by itself, but the word as a whole.
Yet what if I told you you read the top line wrong, and as a result, a patient died? We work in a high-risk industry. Information about what happened would be passed up a chain of command, far removed from the event, and there'd be meetings. There may be a root cause analysis. We may create a policy or education program, or send out an alert reminding staff to read the sign properly. We may do all of these and expend a lot of energy and money in doing so, and we will have wasted our time, because another doctor or nurse will come along and read the sign incorrectly, and another patient will die, because what we should have done was changed the sign. Ergonomics is about designing the workplace and the equipment in it to accommodate for limitations in human performance. It's about changing the sign. Are there thousands of lives to be saved simply through respecting and designing for our human limitation? I believe so, and we needed a way to get the message out.
After heart disease and strokes, medical error has been reported as the third biggest cause of death globally. The exact figure is difficult to estimate because error reporting in healthcare lacks transparency. But mistakes made in hospitals are leaving patients worse than when they went in. A group of medical staff decided enough was enough and began to agitate for change. Communication errors have been identified as the root cause of the majority of mistakes. Staff in operating theatres can work with hundreds of different colleagues between multiple hospitals, and their faces are covered, so in the midst of an emergency, precious seconds can be lost when clinicians don't know or can't remember the names of their colleagues, which can lead to lack of accountability, wrong equipment used, wrong drugs administered, and so on. To improve communication and reduce mistakes, the answer was remarkably simple. To immediately identify individuals and their roles, we began writing our names and roles on our scrub caps. It was a simple act which changed the culture of the theatre from anonymous to collaborative. Suddenly, it was easier to coordinate, to be more accountable and efficient. With the help of a hashtag, the idea began to take off. Medical staff globally joined in. Some even started printing their own name caps. The world sat up and took notice. What started as a simple idea among a bunch of so-called rabble-rousers has grown into a game-changing movement which is saving lives around the world.
It costs nothing to implement. It's obviously better for patient care. So why isn't it already the norm? Surgeons only know 44% of staff names in their operating theatre. Not surprising when we realise as humans we're very poor at remembering names. Name and role caps increase name recall, reduce confusion, and increase the propensity for staff to speak up. They improve communication, morale, teamwork, and ultimately improve patient outcomes. So if it's not evidence or cost preventing us from displaying our names, what's the most likely thing which will lead us to make this positive change for patient care? Seeing others do the same. Our social conformity. Something else interesting is this group. Healthcare workers who will only accept this obvious improvement to patient care if it's made mandatory. Who are these people? What I hope you'll realise is that while this group is relatively small, they're extremely influential. They can stop us from doing something the vast majority of patients want us to do, and the vast majority of frontline staff want to do too, particularly those new to healthcare. So what stops us from doing something we want to do, we know is right and is obviously better for patient care? Fear. So what is it we fear the most? Perhaps we fear most for our careers and those who impact on them. However, these people appear least likely to accept ergonomic change. Top-down structures nurture competitive conformists into positions of power. Are these the people we pander to as we compete against one another? Because this is what we've been nurtured to do, all the way through school, university, and beyond. Suggest something which gives us a competitive edge, and we welcome it with open arms. Even when it costs millions of dollars and 15 years of evidence and 4,000 studies indicate it's of no benefit to patient care. Yet suggest something which takes this competitive edge away. Shigamidex, name and roll theatre caps, and they may be aggressively resisted. Driving positive change in healthcare stirs up so much emotion. Perhaps it's impossible, given the culture we exist in. But then, fortunately for us, an even lower hanging piece of fruit came along. Anaesthetist Dr. Jen Dixon from Melbourne, Australia tweeted this just 2 years ago. Confusion about the internal cardiac arrest phone number within hospitals. It differs depending on which hospital you're in. Standardizing this time-critical number provided a great opportunity to demonstrate how effective a network team approach can be in delivering change and improvement. We crowdsourced the data, finding at least 51 different numbers across Australia, and discovered elsewhere in the world others were trying to do the same. The UK standardised at 2222 10 years ago, and there's a push to standardise throughout Europe and internationally. Dr. David Whittaker, the main driver behind this. So we introduced him to our Basecamp group, a project software platform allowing documents to be stored. Anyone in the group can pitch in at any time. We might, for example, work together on a message to send out further. This infographic sent out on social media. As well as social media, we've great links with mainstream media too. We hit the front page of the Sydney Morning Herald. And all the time we continue to develop strong connections with healthcare governance. And within a year, we'd managed to achieve something which took the NHS twice the time and cost them millions. All this from a single tweet. Ripples of change become waves of improvement. We'd like to drive this change internationally and believe we can. But what is it that makes a hospital introduce change? Perhaps it's something social psychologist Malcolm Gladwell illustrates through this man. This is NBA star Wilt Chamberlain. In 1962, he scored 100 points himself in a single game of basketball, a feat that's never been equaled. What's fascinating, though, is Wilt made 28 points from the free throw line, another unbeaten record. Fascinating because Wilt was useless at free throws. However, the season before, he was persuaded to change his style and throw the ball from between his knees like this. His success rate took off. What intrigued Gladwell most was the following season, Wilt reverted to the regular overhand technique. His success rate plummeted. Yet despite this, he persisted with the overhand technique for the rest of his career and never had a high score again. In his autobiography, Wilt Chamberlain regrets reverting back, however felt he had to, because in his own words, he didn't want to be seen as a sissy. He put his own reputation first, and in doing so, let his team down. A trait which can be common to us all. Question is, would you let your reputation get in the way of doing the right thing? Or better still, can we create a system which aligns our reputation with doing the right thing, which aligns our reputation with providing the best in patient care? Well, yes, we can, and we have. And it's been used with great success in driving emergency number standardization, displaying those hospitals which have standardized in green, those for which we've the details but haven't standardized in amber, and those for which we haven't received the details in red. Scoring in this way encourages transparency, a better score where the information's available. Where required, we can apply this technique to any project. Does your hospital support staff wearing their name and role? Does your hospital have a box of Sugammadex on every anaesthetic trolley? Does your hospital have a red stripe on the wall indicating where the arrest alarm is, improving time to effective resuscitation? Does your hospital provide video direct laryngoscopes in every theatre and promote their use first line for laryngoscopy? There are hundreds of similar initiatives to introduce which will make success easier. Just as domestic equipment has been rated for years, collaboratively we're able to rate the healthcare equipment and systems we interface with. Institutions given an aggregated score based on the systems in place. These scores give impetus for hospitals to improve and move up a league table. This is the Learning from Mistakes League, a subjective table based on frontline feedback. Working together, we're making this objective, driving safety improvements throughout healthcare. Working together, we'll change this and start heading in the right direction. When you next step foot in theatre, you make a choice. You can either carry on in the direction we've all been conditioned, away from improved patient care, or you can choose a different path, one which supports change and improvement. The choice we make is on our caps, and it's for everyone to see. Please, choose to be human and part of a team, and just imagine the lives you'll save. Thank you.